You're listening to the Cheeky Clinic podcast. I'm Dr. Chris Delp.
And I'm Kat Parker Delp, owner of Duluth Med Spa.
If you've arrived at a point in life where good enough is simply just not good enough for you, you're in the right place.
Here we cover topics like sexual health and wellness, hormonal balance, and body optimization. And we deliver to you lessons from our travels from hard-to-get-to places around the world.
We are so excited you're here to venture off the beaten path with us into the taboo, where no subject is off limits.
Welcome to the Cheeky Clinic. Let's dive in.
Rejoining an issue that I think deserved 2 podcasts at minimum, if not more. And the question that was asked was what tools that we have. Let's say you're having menopause, and why can you not be treated? So, first of all, tell us. Having gone through yourself personally, what were your symptoms and what were you feeling and what was the driver there behind all of this? This is what menopause did to Kat.
What menopause did to Kat, it just rocked my whole freaking world, man. It was wild. It was a wild ride. I think it was such a wild ride for me because it was not me. I knew that what I was feeling was not me. It was not me. It wasn't how I have ever felt.
What do you mean?
There were the initial symptoms that we talk about. Oh, I'm having night sweats, having the night sweats. That's the common symptom. I wonder if I'm going through perimenopause because I'm having these night sweats. And that's something I would say most women talk about, and it's talked about, at the dinner table, the night sweats. But what are those night sweats really doing to you? Now you've dysregulated, you've disrupted your sleep. I felt like I was waking up in a puddle of, that I needed to change the sheets because of the sweat. Now my sleep's disrupted. Now this is day in, day out, sleep disrupted. Now I have no sleep. So my brain is anxious. Now I'm laying in bed anxious at 3 a.m. because everything's big at 3 a.m. So there's all these things that would lead me, these different problems that would lead me to a provider or, they say, oh, well, it's menopause. You're going through, you've got the night sweats going through menopause. I never knew that there was anything that I could do in that perimenopausal stage to treat those things.
Those things. So far you've only talked about night sweats.
But brain fog, that was a huge one. Lack of spontaneous arousal. Now I can tell you, in my younger years, I could think of something. I could almost think myself to an orgasm with nothing else around. Could literally think myself to an orgasm. Truly. And all of a sudden, that was huge for me because I have always been a very sexual being. And now that was something that didn't spontaneously happen in my brain.
What did you need me for then?
But to finish the job. But yes, I feel like as going through menopause, you don't have those same desires that you had.
So the night sweats were disturbing. The brain fog was, and then
lack of libido
was a huge one.
I could see my skin changing before me. I literally felt like all of a sudden I could physically see the skin, not just like my face, but my hands, my arms, this crepiness, the crepey skin. That is a thing. So I could see all of these things being depleted from me, and I couldn't do anything about it. I could, but I wasn't aware that I could. There was not enough support out there. I was not aware that there was help for these things prior to menopause. These are all perimenopausal issues. These are things that were happening prior to my, menopausal state. So I could have been getting help all along, and that's when I feel like I needed it. Perimenopause is when I needed the support of the hormone replacement.
So one of the other symptoms, and one of my favorite things in treating this is when couples come in together. And one, it's so gratifying when a woman says, this is my husband. I love him. And I used to just want to jump his bones all the time, and I don't. And there's something wrong, and I want to feel that way again. And I appreciate that they appreciate what, as you did, that there was something that was missing. And then when we're talking about symptoms of menopause, there comes one of my standard questions is moodiness. And that's like stepping on a landmine. I approach that very carefully, and I usually look at the husband and say, has she been moodier than normal?
Oh, yeah.
And if she hears that, she's like, what do you mean? I have not been moody. So it's moodiness is another one of those symptoms.
Huge. It's a huge problem.
So back to your original question. The tools that we have, and why is there a lack of tools? And part of it is there are a few tools. One of them that is that you've already mentioned, which I think is really important, is estrogen creams. Using vaginal estrogen creams can make a huge difference in women's lives. And when you talk about libido, testosterone certainly has a role in libido, but also estrogen, in that if intercourse is painful, you're not going to want to do that. And when you use estrogen creams, it certainly it can preserve all of the tissues, make them more responsive, and continue the enjoyment.
And sex should never be painful.
Yeah.
Regardless, ever. I just got to put that out there. It
Yeah.
should never, ever be painful. That is an enjoyable thing. Sex should not be painful. So menopausal sex should not be painful.
We're not going to talk about the whips this episode then.
Okay, that might be painful, but that's a desired pain.
So what other tools are there? Now, of course, the natural response is, if you're low on estrogen, give the woman estrogen. How do you give a woman estrogen? Well, there's estrogen pills. And there's lots of different formulations of estrogen. And what you'd want to do is give a woman the exact same estrogen that her ovaries make. And there's different forms of estrogen, and we can get into the technical details. But I don't think that we're really interested in technical formulations of the different forms of estrogen. But the important thing is how it's delivered. When you take any pill form, when you take any medication, anything that you take orally, it goes into your stomach and your intestines, and that all drains into the liver. So your liver receives everything that you take orally. And when you take an estrogen pill, your liver gets all of this estrogen all at once, and that stimulates clotting factors. Estrogen has got a lot of effects on the body, but when you have a huge amount of estrogen delivered to the liver, your liver senses all of this estrogen, and it makes more clotting factors, which is why oral estrogen does increase your risk of blood clots, whether that's blood clots in the legs, blood clots in the lungs, or stroke. And so oral estrogen, and most women that have been on birth control pills, they may not remember their doctor telling them about this, but it's on the warning labels. Your doctor talked to you about that being on oral estrogen increases your risk of stroke, of blood clots to the legs.
And I think some of those warning labels are outdated, but we can discuss that later. A lot of those warning labels are very, very outdated for outdated studies that that needs to be voiced in itself. A lot of the concerns, a lot of the studies were outdated studies.
So we'll talk about myths, I think, and we'll follow up with myths. But oral supplementation is not ideal. I think there's very clear data
Mm-hmm.
that oral supplementation is not ideal. You get big peaks, you get troughs, you do have increased risk of definitely increased production of clotting proteins. Um, so
Vaginal estrogen cream.
no increased risk at all.
And you know what's on the warning label of vaginal estrogen creams? When we as women get those or pick up our prescription, all of those warnings are in there for vaginal estrogen cream. They're in all of the warnings of that. And it makes this hysteria of women that are like, "Oh, I see this on it's vaginal estrogen cream." Those kinds of warnings need to be updated because they are on warning labels for vaginal estrogen cream.
And that's clearly not accurate. I mean, there's so many studies that back that up. Um, so moving beyond the vaginal estrogen cream, if you want to replenish all of these hormones, how else can you do it? Well, there's patches. You can certainly apply a patch, and if it's introduced through the skin, not all that blood flow goes to the liver. It is delivered at a much more slow rate. And our objective is to try to deliver it like your ovaries did. And so there's oral troches that are absorbed in the mouth that can, again, be, if you're not swallowing it and it's still delivered, very similar to the subcutaneous. And then there's pellets. And pellets are small hormone combinations that are a little bit bigger than a grain of rice, and they're implanted under the skin. And they deliver a very constant, consistent hormone level. Again, very low. There is absolutely no risk of blood clots with pellet therapy. The added benefit is that you can also do testosterone as well as the estrogen. Progesterone, progesterone is always better orally.
Mm-hmm.
You can do pellets. You can do other forms of progesterone, but what we find is the best protection and the best effects of progesterone are orally. So a nightly dose to help you sleep, and you get peak levels, which helps
I
prevent
feel
cancer.
strongly that in perimenopause, when people are going through the perimenopausal stage, that they should be offered progesterone. Yes, they're still producing it, but they really should be. That would be a game changer for so many women going through all of these night sweats and all these things that a little progesterone goes a long way. And you're losing that. Insist that your provider look at that. It is something so simple and a little dose of progesterone every night that can really change things for you going through menopause. It can change all of your sleep habits, all of that. And so those little things that just don't get offered to women that are as simple as progesterone. I agree. I think that that's something that should be started early on.
So pellet therapy is very uncommon.
Mm-hmm.
You usually need to seek out a provider
Mm-hmm.
who's trained in pellet therapy, who knows what labs to order, how to follow up with the labs. This is a very scientifically based practice where you draw levels, hormone levels before, have your pellet, have them drawn after, and that's not being trained in medical school. And during residency programs, that's not being trained. That's something that a provider needs to seek out in order to benefit their patients. And so when you talk about why isn't this happening, well, it's not part of the training. It's not part of the residency, and you have to have experience, training, and a pharmacy, a pharmacy that's able to provide those pellets to you, and the support to be able to monitor that.
And tell us about how often that replacement needs to be done. What's the testing involved in that, and how often would women need to have that replacement versus taking an estrogen cream or an oral tablet, or what's the differences in that?
What a great question.
I know.
You know what the definition of a great question is?
One that you know the answer to.
Oh, well done.
I know you so well.
Yes, you do. um, so, there's lots of different types of pellet therapy, and they have a lot of research behind them. And the the two largest brands are Sotopelli and BioT, and there was
Company
some
names.
common names, and they're related, but they both have a lot of very good research behind them, and so. What we talk about is how does this process look? First, you ask yourself the same questions that you did. What kind of symptoms are you having?
What the hell's going on with me?
Yeah, and do you want these symptoms? Are they bothersome enough to you where you want to change? There are lots of women who say, "I'm fine."
Yeah.
And that's great. We're not trying to change anybody and make you convert to pellet therapy when you know that doesn't seem like it's a good fit for you. Then don't. Absolutely. But if these symptoms are bothersome for you, take this little self-assessment, and then you get hormone levels drawn. We look at those levels and see how they compare to what you were premenopausal.
And a lot of that's symptomatic. I mean, it's all some of the levels drawn can be based on, because the levels get drawn and it's 0. So that's normal. 0, that's your labs may be normal for what normal is for a menopausal woman.
Right.
But you can look at the symptoms and say, this isn't normal for what this person's labs were for what she's experiencing.
So the bottom line is what you're talking about is you take into consideration the person and not just the number, and so once you have levels drawn, then you calculate how to balance the levels based on the lab and the symptoms, and then you get pellet insertion. Now these pellets a little bit bigger than a grain of rice. It's like an oversized needle that you put in a couple of pellets, usually in the buttock area, and then you see how the pellets did post insertion, and this happens usually 3, maybe 4 times a year, usually 3 times a year. Men, it's different. And we're not going to talk about men, but it's less frequent.
Because we don't care to talk about men today.
We talk about it ourselves so much.
But the pellet insertion itself, that procedure is super quick. I mean, it is in and out. It takes just a few minutes, and it's easy. Way easier, in my opinion, than putting on a patch or doing all the other things.
There's certainly advantages, and we've looked at those
that.
advantages and disadvantages from a scientific point of view. One of the biggest advantages is patient compliance. You can't take a daily pill to save your life. If you ever develop,
I am non-compliant. If someone were to look into my medical record, it has non-compliance written all over it because but anyway, I agree. I don't comply.
If you ever need any kind of medications on a daily basis,
I'm out.
No, I've already got a plan. We calculate your wine intake, and I dissolve as many tablets into a wine bottle so that when you have your nightly glass of wine, you're getting your medicines, because that's one thing you're very compliant about. The compliance is great. Since you only have to do this 3 times a year, it's very easy to do. Patches, there's a little skin irritation. It's hard to remember to do the patches on a regular basis. And the delivery is very consistent, and it's got the added advantage of doing the testosterone supplementation.
Yeah, I was just going to say with the patches, you're not getting the testosterone, and some people For some people, that is a huge issue. So I think it takes into play the different, what is bothersome to you? What part of, of going through this process as a woman is the most important aspect to treat. And just to know that there are ways to treat it. It does not have to go by the wayside. You've had these hormones in your body for your whole life. You don't have to not have them now. I feel like in this time frame, we are finding a lot of other places, providers that will offer estrogen, but not a lot of providers are saying, oh, there's a testosterone component to it.
And there's some women who may benefit just from testosterone.
Exactly.
So there's that option too, where we're just doing testosterone supplementation. And so the reluctance, and this is going to come back to you, which it always does.
Oh my God.
You were interested in hormone replacement years ago. And my training as a physician generated a response. No, don't do that. You're going to get breast cancer. I mean, obviously, you're going to get breast cancer. Right. So why would you pursue something like that when it's going to cause you to get breast cancer? So don't do that. And that was my response.
And that is not the
true.
case.
It's not true.
It's simply just not true.
So why did this come up? Why did this come about? And I know the answer because when you were insistent and you told me I was wrong, my first response was to argue.
Yeah. That you do so well. You do that so well.
I'm a doctor. I'm a doctor. I'm not wrong. This is Dr. Delp. I'm not wrong. And so I think you go through kind of the same Kubler-Ross stages of grieving. It's that shock, that anger, denial. I'm shocked that you would accuse me of being wrong. I'm angry at you for denying that you're wrong.
She's right.
Yeah. And then finally the acceptance. And the acceptance came through research and looking at first as to why I felt the way that I did, because I didn't feel that way spontaneously.
You rightfully felt that way. You were justified in feeling that way.
Women's Health Initiative that they talk about the results of that and a measurable increase of breast cancer. And that data is wrong. It's skewed, and there's politics that were involved with this. And I would, and to any of our listeners that are on the fence, and you've heard this before. Oh my gosh, it causes breast cancer, and this is one person's opinion. There's a deep dive into this research in a book called Estrogen Matters. It's available. It's written by an MD and a PhD that have researched this exhaustively, and they're not the only ones. There's lots of books out there.
There's lots. I encourage anyone to go down that rabbit hole.
Yes,
100%.
But this is a really enjoyable audiobook or something to read that talks about why this whole bias occurred about breast cancer and estrogen. And the bottom line is that estrogen, like you said, bioidentical hormone replacement with estrogen does not increase your risk of breast cancer. That is the end of the story. Now, we can delve into lots of particulars about it, but that's really the fact. As a matter of fact, when you talk about balancing hormones, and that kind of hormonal harmony, women with low testosterone levels do have an increased risk of a particular type of breast cancer. So when you talk about hormonal harmony, that involves...
I like that, hormonal harmony. That's what I want to live in. I need a crown that says hormonal harmony. Yes. I want to be
Um,
in hormonal harmony
yeah, thank
forever.
you. I wish I could take credit for that, but I think there's probably somebody else who's used that in the past, probably multiple people. But yeah, that when you talk about balancing all of those hormones, testosterone, estrogen, and progesterone, then you actually have a decreased risk of cancer, both endometrial and breast cancer. And this isn't me. These are multiple studies in multiple countries, um, uh, and that we were misinformed
One study.
by one study, and the authors of this study. There were several members that withdrew their names
Were they
and
men? Were
resigned.
they men in the study?
We're done man bashing here. You can wait till after this episode to man bash.
Were they men? Were the study? It was, yeah.
There were men and women, but there, yeah. So but there is some political motivation in that original study that skewed the results, and
And the type of estrogen used in that study. I mean,
there, there's lots of
it's
variables
a lot of variables there. But
there.
yeah.
So, when we talk about tools to help these symptoms, and what people can provide, certainly the estrogen creams is one. Patches,
Yeah.
although you can't, it's I think it's difficult. You can't get the testosterone in with
Correct.
that, and then there's pellets that offer the added advantage where you're doing measurements before pellet insertion.
Hormonal harmony.
Yeah, the hormonal
The
harmony.
hormonal harmony is in the pellet. I'm a firm believer in hormonal harmony in the pellet. So
So I think the myths, the biggest myth, is that it causes cancer. Now, there's one caveat, and that is if you have a uterus and you're getting estrogen all the time, the uterine lining is being stimulated. That's what estrogen does. And if you don't balance that with progesterone, there's some very clear indications that unopposed estrogen can increase your risk of uterine cancer. But when you supplement that with the appropriate dose of progesterone, which we do, that risk not only is eliminated, it actually reduces the risk of endometrial cancer. So again,
these are hormones that we have always had as women. These are normal. The hormone replacement is not causing the cancer. These are hormones we've had forever. You know, I mean, as young women, we're introduced to birth control pills and all of these things, and then we hit the certain age and they're like, nope, you can't have that anymore. Are you kidding me right now? What the hell are you talking about? Like, I've had this my entire life. And so I think that is what is the most important here, is that this is all normal in our body. These are normal hormones that we have always had. And when you take those away and you don't give us those, it is causing more problems than good. If you continue to have the hormones that you are intended to have, they're just going to benefit you in so many ways, sexually, mentally, physically, muscles. Everything about you is going to feel so much better to continue to have that. But when you take that away and you just, think that you can't have it, it doesn't make any logical sense. Of course it's going to harm you not to have them. Anyway, that's my passion for the day. But I get so heated on this topic because I feel like it was such a life-changing time for me, more so than becoming a woman, the having children phase of my life. Menopause hit me hard. It hit me fucking hard. It did. And I'm so grateful that there are options out there to make life normal again. My life is normal, and it should be. But anyway, I can go on about this forever, but I just appreciate your understanding and your knowledge and education and understanding that this is a problem for women and it's treatable, 100% treatable.
You communicated very effectively the impact that this was having on you. And I think that this podcast is also should be a little bit about for the men as well, in that it's very easy and very understandable as a man. Your wife goes through menopause and she doesn't want sex. And you're, as a man, they talk about menopause, and it's nice. It's a nice little phrase.
Go there.
But it's not
Yeah.
it's not a physiologic change like women go through.
Right.
So it's not. There's no equivalency. There's absolutely
Absolutely
no equivalency to that. So men are still experiencing spontaneous desire.
Yep.
They are.
They still have that hormone.
Yeah, they do. Absolutely. And we are going to talk about male hormone replacement as well. But now I still desire you, and you no longer desire me. And that, instead of being like, she just doesn't want me anymore, talking about that and saying,
the education is so big.
Just education and communication, just don't you want me anymore? And in my clinic, when you've brought people in to see me, the woman universal response is, I want to want him.
100%.
I want to be like I was in my 20s. I want that. I just don't feel it. There's nothing
that
there.
can turn it on.
And so, but it's really easy to turn that into conflict, and then to guilt, like, well, you never want to have sex anymore. And then the woman feels obligated. Well, and that whole pressure to now have sex when you don't want to have sex, in order to please the man, sets up a negative feedback loop, where sex becomes less and less enjoyable. And not only do you not have any desire, now it's painful.
Now it's a chore.
And now it's a guilt. Anytime there's sex out of guilt, you can
that's called bad sex.
Yeah, absolutely. And so when you can communicate effectively to your husband and back, and your husband as well, it's like, I want you to want me. What's going on? Instead of saying you don't, it's your fault.
Right.
Because this is not is not a fault issue.
That's a lot on the women as well. I think menopausal women, communication is huge. If I could tell a menopausal woman one thing, going through this, it would be to let your significant other know it is not about them. And it's not. There is 100% help for you, but it's so important as a woman going through perimenopause and menopause and those hormonal changes, is to voice the fact that it is not about your spouse. It's something that you can't control, but there's help for it. That's the beauty of it. I think that just more education, there needs to more, we need to shine more light on the fact that you don't have to go through this as a bad time. It can be a completely harmonious time in a woman's life, because you can get the hormones that you've had your whole life. They're there. You can have them.
And that kind of open communication, one of the things as a physician that I'm constantly humbled by is how, people will be very open with what's going on. And these women that come to me and are very emotional about how passionate they are about their husband and how much they miss wanting sex, and that they know their husband wants it, and they want that for themselves, but they also love their husband and want that for them too.
Right.
And that kind of that those women that are wanting to improve their relationship, and they're just looking for anything to help them regain that. And it's such a powerful thing to hear that, and then we can help them.
Yeah, absolutely.
We can say, yeah,
Doesn't have to be that way.
it doesn't have to be that way. Going back to your point, it's not how much time is left in your life; it's how much life is left in your time, and to make those moments, the time that we do have left, because we never know how much time we've got left, but to make those moments in our life what we want is really what we're after.
Thanks for joining us on a cheeky adventure through the world of wellness. Follow our spicy tips, laugh out loud stories, and expert advice designed to keep you feeling youthful, vibrant, and always in the loop.
Follow the show so you don't miss a beat. Stay connected and let's keep the fun going.
And if there's a subject that you'd like to hear more about, please let us know. You can connect with us by clicking the contact link below or send us a message on social media.
Make sure to send this episode to a friend who could benefit from today's topics. And don't forget to leave the show a 5-star review.
Thanks for listening to The Cheeky Clinic. We'll see you in the next one.